Muscles of the hip today, and we'll also get a few muscles which will work on the knee itself as well. The hip is a ball and socket joint and arthrodial, so it moves in 3 different planes. 6 different movements can happen, 2 movements per plane. So let's talk about those muscles which can do that. So in no particular order, we're going to start on the lateral surface. Looking here at gluteus maximus, which is a large muscle which does hip extension, also does a little bit of lateral rotation and abduction. I'm going to move over this direction here. I'll take gluteus maximus off. And we're seeing underneath it is gluteus medius on either side, gluteus medius. This is an abductor and an internal rotator inserting into the greater trochanter, which we can see right here. Deep to gluteus medius, if I just turn this model around here, is gluteus minimus. We can see gluteus minimus and gluteus medius, again both inserting into the greater trochanter. We'll come back up to this model again. We'll stay on the lateral surface over here. We've taken off gluteus maximus. We're looking now at the deep 6 lateral rotators, of which we can see 5. Piriformis, superior gemellus, obturator internus, inferior gemellus, and quadratus femoris. Note that all of these go to again insert into the greater trochanter. Obturator externus, not visible, also attaches to the greater trochanter. This means that we have gluteus medius, underneath gluteus minimus, piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris, all attaching, and obturator externus, all attaching, that's 8 muscles, into the greater trochanter. Notice that the sciatic nerve in most of the population will come out inferior to piriformis. Let's move this, just twisting more into an anterior direction now. We'll see tensor fasciae lata originating up onto the anterior superior iliac spine, and notice how it shares a common origin with this beautiful muscle sartorius. So sharing the common origin, tensor fasciae lata and sartorius on the ASIS. Notice that the origin of rectus femoris is a little bit more inferior onto the anterior inferior iliac spine. Looking at quadriceps, vastus lateralis, notice a very large muscle, has a big attachment site on the back of the femur, the linea aspera. Moving over here to vastus medialis, also has a big origin on the linea aspera. Underneath rectus femoris is vastus intermedius. So those make up our 1, 2, underneath 3, 4 quadricep muscles. Looking at the adductors, well, first of all, I'm going to start up here on the inner surface of the ilium is iliacus. And iliacus, better seen on this model here, joins with the tendon or the muscles from psoas major and minor to form the common tendon of the iliopsoas. Iliopsoas is shown here. Here we see the femoral nerve, artery, and vein, or spelt van from medial to lateral, vein, artery, nerve. This is pectineus sitting up here, originating up on the pubic crest, inserting into the pectineal line on the back of the femur. Adductor longus, beautiful graceful muscle of gracilis. Adductor magnus here, here, as well as here. It appears to be almost 3 separate muscles, 2 different innervations, obturator and tibial, but essentially the action is adduction of the femur. Turning over to the hamstrings, semitendinosus up on top, semimembranosus is beneath. Biceps femoris long head, underneath it biceps femoris short head. The innervation of the 3 of the 4, that being tendinosus membranosus and biceps femoris long head, tibial nerve. Note that 3 of those 4 also have a common origin, ischial tuberosity. Let's look at another common, this being insertion. Sartorius, gracilis, and semitendinosus follow these 3 tendons to their insertion point onto the proximal anteromedial tibia. They actually insert in one area, and this area is known as the pes anserinus, goose foot. And we can see the tendons do somewhat resemble the foot of a goose. And that is most of the muscles of the femur. We'll take a look at some of the bony landmarks that we've talked about. Here we're looking at one half of the pelvis, known as the innominate bone. 3 parts: ilium, ischium, pubis, iliac fossa, pubic crest. This is the rami, going all the way around the obturator foramen, acetabulum, iliac crest. Some people are challenged to find the orientation for anterior versus posterior. Sciatic notch posterior. That means the sciatic nerve at the back. Posterior superior iliac spine, posterior inferior iliac spine. Anterior superior iliac spine, anterior inferior iliac spine. This is the iliac crest. Ischial spine, ischial tuberosity. And final 2 bones, we'll take a look at 3. We'll look at the femur, head of the femur, neck of the femur, lesser trochanter, greater trochanter. Again, notice all the muscles inserting into the greater trochanter. We talked about 8 muscles inserting in there. Lesser trochanter, iliopsoas, the common tendon of iliopsoas, inserting into the lesser trochanter. Here we see the linea aspera, this large line down the back of the femur. We see the roughened gluteal line from gluteus maximus and the roughened pectineal line for pectineus. The rest of this, these 2 join together to form the linea aspera. Pectineal line, gluteal line, coming together to form the linea aspera. We'll leave that for now. Coming into the tibia, here is the goose foot, pes anserinus. Semitendinosus gracilis and sartorius. Tibial tuberosity, Gerdy's tubercle, the insertion for the IT band. Tibial plateaus. Onto the fibula, because we're just looking at the muscles of the hip and a little bit on the knee. We'll just see this one on the head of the fibula, long head of biceps femoris. This one is going to be innervated by the tibial branch of the sciatic nerve. Okay, we'll leave it at that for now.